So welcome back guys. Now in this particular section in the soil transmitted helminthing diseases, in the last one we have talked about the ascaris, right? Ascariasis, where we have talked about causative agent, that was Ascaris lumbricoid, that was a giant round worm, right? In this particular section I am going to talk about the hookworm, right? So let's talk about the hookworm guys. Here we are talking about two important diseases over here, okay, which is the causative agent of the hookworm basically, okay, and that is the one is the Necator americanus and another one which we are reading, that is the Ancylostoma duodenale, right? So first one is the Necator americanus, right, and the second one is which we are going to talk about, that is the Ancylostoma duodenale, right? Ancylostoma duodenale. Okay, so basically this is the hookworm, and if you talk about the reservoir of the hookworm, right, that is obviously the human, and the source over here would be the soil. So basically these are the soil transmitted, from the soil they are getting transmitted, right? Soil transmitted helminthic diseases or helminthic infections, right? Okay, now can you see this image particularly? Right here what we are seeing that, you know, this is the hookworm which is present just beneath the skin of the person, right? Just beneath the skin of this particular leg over here, right? So in the sole particularly, so basically they are getting, this is the cutaneous, right, cutaneous root. So I will be talking about the life cycle over here. Usually if you talk about the length of the male over here as compared to the ascaris, they are very shorter, right? So usually if you talk about the length, okay, so length of the male over here, okay, male, I am just denoting it like this, okay, and length of female I am denoting like this, right? So length of male, if we talk about, that is around 8 to 11 mm, right? And for the female, if you talk about, that is around 10 to 13 mm, right? Let's talk about the life cycle guys over here, right? Let's talk about the life cycle, then we'll talk about other salient features of this one. So if you talk about the life cycle, here we are seeing that this is from the CDC guidelines, okay? So this is the intestinal hookworm, where we are talking about this particular life cycle, right? Hookworm, Ancylostoma duodenale and Necator americanus. Over here, first of all, what happens is, you know, there are from the intestine, the eggs are coming in the feces, right? So in the feces we are talking about, first of all, there is a eggs in feces. These eggs, okay, where you are seeing basically from the eggs there is a larva which is hatching over there. So rhabditiform larva hatches. After that there is a development of this particular larva. This is a filariform larva. So this is development of this filariform larva, okay, and once you are seeing this particular larva present over here, okay, that much big larva is there, right? So this particular larva will be actually penetrating the skin of the person. For example, the person was walking, okay, or the person was swimming or something like that, right? Through the skin they will be making their entry into the human body. So filariform larva will be penetrating the skin now. Filariform larva will be penetrating the skin now. So this is the infective stage of this particular larva, right? Once they are penetrating the skin, right, through the circulation and all, they are coming into the intestines, they are coming into the intestine, right? They are coming into the intestine over there, right? And in the intestine you are seeing that adults in the small intestine, right? There could be the male, there could be the female. So there could be the Ancylostoma duodenale, there could be the Necator americanus, or there could be the Ancylostoma selanicum, right? So basically over here what we are seeing that it was presenting in the feces. From the feces it got into the larva stage, okay, through the hatching, and that larva will be getting entry into the human body through the cutaneous route. They will be entering into they will be penetrating the skin. For example, I showed you this particular image. This is the penetrating of the skin, isn't it? So through the penetration of the skin they will be entering into the human body. Finally they will be going into the small intestine, okay. From the small intestine they might go into the lungs, okay, and through the lungs they might be taking the exit as well. So larvae exit the circulation in the lungs, they are then coughed up and then re-swallowed back, okay, and that's how they are infecting the human, that's how they are infecting the persons or the human, right? Here they are saying that Ancylostoma species larvae can become developmentally arrested and dormant in the tissues. So they might be dormant in the tissues for the longer time as well, okay, and once the person immunity will be immunocompromised, they might be actually entering the small intestine as well, right? So that is the life cycle of the hookworm basically. Okay, that's the life cycle of the hookworm basically. And here we have talked about that how the filariform larva might be getting entry into the skin and then penetrating the skin, and how they are actually reaching up to the intestine over there, right? Okay, so once we have talked about the life cycle over here, we have talked about the length of the male and female. Sometimes they might ask you, then what is the optimum temperature for the proliferation of this particular helminth? So optimum temperature, I told you it was around 20 degrees Celsius, okay, or more than 20 degrees Celsius for the ascaris. Here I am saying that optimum temperature for it is the 24 to 32 degrees Celsius approximately. Okay, if you talk about the living nature, in the ascaris I told you they were living in the hard soil or the clay soil, and here I am talking about lives in soft soil or the porous soil. Okay, those embryonated eggs basically, that is the difference between these two. Other thing, what is the incubation period as far as the hookworms are concerned, right? Incubation period, I told you for the ascaris it was around 18 days to the weeks, okay, it was happening. And here I am talking about the two different incubation period might be there, one for the Ancylostoma duodenale and another one for the Necator americanus. For if we are talking about the Ancylostoma duodenale, right, there might be the Necator americanus. Okay, so what are the Necator americanus? Okay, so what are the incubation period for these two? They might be asked separately. Okay, so around 5 weeks to 9 weeks, around 5 weeks to longer one, almost around a year, 5 weeks to 9 months, that is around that is the incubation period might be there for the Ancylostoma duodenale. And for the Necator americanus it might be around shorter one as compared to the duodenale, that is around 7 weeks. Okay, so for the Necator americanus it might be around 7 weeks, right? What is the period of communicability if you talk about? So if you talk about the communicability basically, right, as long as they are present in the stools of the patients, right, as long as they are present in the stools basically, they will be liable for spreading the infection, as long as helminth present in stools. Which helminth? It might be Ancylostoma duodenale, it might be the Necator americanus, right? As long as they are present in the particularly stools of the person, right, they might be actually transmitting or causing this particular disease further as well. Okay, as long as these stools they will be containing the eggs, as long as they will be containing the eggs, these embryonated eggs, they will be causing the disease in the community, right? These helminths are basically, these hookworms basically, they are the most common soil transmitted infection which might cause anemia in the community or anemia in the persons, right? Because they are causing the blood loss, because they are causing the blood loss over there. So due to the blood loss, right, so they might be causing the blood loss. Due to the blood loss there might be the anemia in the persons, right? In some cases they might be causing the loss of protein also. So in those cases they might be causing the hypoalbuminemia also, right? And that might be the problem again. So guys, over here this is the most common, right? This is the most common hookworm in the soil transmitted infection diseases, right, causing anemia in the patient, anemia in the patients, right? So this is the most common hookworm which is causing the anemia in the community. It might be causing the albumin loss also, or the protein loss also, so might be causing the hypoalbuminemia as well, right? Once we have talked about that, a very particular thing is there that is called as the Chandler index. Chandler index is basically telling us Chandler's index, okay? Chandler's index basically, it is the parameter by which we are actually determining the eggs in the 1 gram of feces among the population. Okay, so what we are checking with the Chandler's index, basically it is nothing but eggs present in 1 gram of stools or 1 gram of feces among the population, right, among the population. So basically it is talking about the criteria over here. For example, at one side I shall write about the eggs which are present in grams per stool, right? On other side, on the another side we shall write about the whether it is the public health problem or not. I told you about the ascaris also. If it was hatching around more than 50,000 eggs per gram stool, okay, it was the public health problem, right? And for that was the standard index for the ascaris. If you talk about the hookworm over here, x gram per stool, okay, how many x might be present over there? So if the less than 200 is there, then it is not significant, no significance of there. So it is not the public health problem in that case, okay. Okay, and that should be our target as far as these hookworms are concerned, right? If it is 200 to 250 or 201 to 250, I would be saying, okay, if it is 201 to 250, or it might be 251 to 300, or what about more than 350? Okay, so if it is 201 to 250, then it is the potential danger. Then this is the potential danger basically. Okay, it might cause the public health problem in future. If it is 251 to 300, yes, it can cause the public health problem, right? So it is the minor public health problem in this case, minor public health problem. Okay, and if it is more than 350, then it is the major public health problem. Okay, understood? So that was about the gender index. At last, how to prevent this? Very simple. The prevention part I told you earlier as well, that you need to take care of the sanitation measures, right? You need to take care of the sanitation measures, right? Proper excreta disposal. Okay, you need to actually reduce the incidents where the open defecation is going on, right? You need to reduce those incidents over there. Sanitation, proper sanitation measures, right? We are talking about them from the last videos itself, right? How to actually control that sanitation measures. Proper food supply should be there, water supply should be there, right? Food hygiene must be taken care of. So all of these factors must be taken care of. So food hygiene, water supply, right? Excreta disposal, disinfectants, right? Food hygiene, water supply must be taken care of, right? Proper excreta disposal, right? Open defecation, you should stop the open defecation. Stop open defecation, right? Okay, so these might be the some measures which we shall talk about, right? As early we will be making the diagnosis of the hookworm again, as early we will be able to treat them, right? So early diagnosis, early treatment, okay, that is the prevention part over here. So secondary prevention, I would write over here that, okay, this is the primary prevention, which I am telling you. Sanitation measure is the primary prevention, right? In the secondary prevention, we shall be saying that, you know, try to make the early diagnosis and early treatment, right? So early diagnosis and early treatment. Okay, that will be our goal. Right, so now if we talk about the treatment as far as hookworm is concerned, guys, right? So here the drug of choice is albendazole, right? Drug of choice over here is albendazole, right? We are giving it 400 mg in a single dose, right? 400 mg in a single dose. We shall also give the mebendazole, right? I'm just changing the color. Mebendazole, right? And we shall give it 100 mg in 2 divided doses, right? And we can give it for 3 days, right? Then we shall be giving the levamisole as well. We shall be giving the levamisole. This is the most effective treatment. This is the most effective treatment, guys. Okay, and what would be the dose over here? Dose over here would be the 2.5 mg per kg body weight. According to the body weight, we are giving it 2.5 mg per kg body weight, and maximum we shall go up to maximum dose which shall be given, that will be 150 mg. Okay, so we are having mebendazole, we are having the albendazole, very important, this is the drug of choice, and we shall be having the levamisole as well as far as treatment modality is concerned, right? If we talk about the mass chemoprophylaxis, okay, they might ask you, what about the mass chemoprophylaxis as far as hookworm is concerned? Okay, then we shall be giving to the children and the adults, two conditions can be given, two conditions can be taken care of, right? So one is the children. For the children, if I'm talking about children, I'm talking about the age group, like for an example 1 to 2 years of age group I'm talking about, right? If I'm talking about the children, basically we shall be giving the albendazole in these cases 200 mg, okay, and that is coming in the half tablet form, right? Remember I told you the albendazole we were giving 400 mg, okay, so we'll give the half of it, half tablet will be giving, and that will achieve our target, that is a 200 mg, right? If I'm giving to adult for an example, or if I'm giving to adolescent, that is more than that, right? For example, more years. So I am talking about more than 2 years, 2 to 19 years in this case, right? So in these kind of cases, we shall be talking about the dose of full tablet, that is the 400 mg. Okay, that will be the chemoprophylaxis, right? And at last, let me differentiate. Let me make the differentiate table for you guys so that you are having a proper difference in your mind as far as ascariasis is concerned and the hookworm is concerned. So what is the difference between ascariasis and hookworm? However, we have covered that. Okay, so just to make proper understanding, just to make the things fall in the right place. Okay, so let's talk about the difference between the ascaris, or I would say ascariasis. Yes, it was the giant round worm actually, and this is the hookworm on the other side, right? So let's try to make the difference so that everything comes into the right place. Okay, so ascaris versus hookworm, guys. So if you talk about ascaris, if you guys remember, I told you this is the giant round worm, right? Okay, big round worm you are seeing over there. Okay, we have seen the pictures as well, right? 15 to 30 centimeter as far as male is concerned, 20 to 35 centimeter as far as females are concerned, right? Okay, ascariasis. Okay, here we were talking about that it was actually living in, it lives in the hard clay soil. It lives in the hard clay soil, and as far as hookworm is concerned, it lives in soft porous soil, right? Soft or porous soil, right? As far as length is concerned, 15 to 30 centimeters length. Okay, they are having, okay, 15-30 centimeter long on an average, approximately I'm talking about. As far as these hookworms are concerned, they are particularly short as compared to the ascariasis. They are about 18 to 13 mm long approximately, or 8 to 13 or 8 to 15 mm long over there, right? Here we are, if we talk about the lifespan of the ascaris, we have already talked about that it is around 1 to 1.5 years, and lifespan of hookworm, as far as lifespan of hookworm is concerned, it is around 1 to 4 years. So it is longer as compared to the ascaris. If we talk about the egg laying capacity, that is very much high in the cases of ascariasis. I told you that 2 to 3.5 lakhs eggs per year it might be actually generating. Okay, not per year, per day actually. Okay, and if you talk about the hookworms, basically you can actually go for 5 to 30,000 eggs per day it might be laying off, right? If you talk about the which infective stage is there, so eggs, here the eggs are infective in the life cycle. If you are talking about as far as ascaris is concerned, eggs are infective. Here larvae are infective. Okay, so please do remember about that as well. Okay, here the optimum temperature which I was talking about, that was more than 20 degrees Celsius, and I told you inhibition of the ameliorated eggs will be seen less than 16 degrees Celsius, right? So here it was 20 degrees Celsius, and in the category of hookworm it is even more, that is 24 to 32 degrees Celsius about. So optimum temperature as far as hookworm are concerned, that would be around 24 to 32 degree Celsius, right? And I told you that ascaris was the most common soil transmitted infection, most common soil transmitted helminth, I would say, most common soil transmitted helminth, and hookworm is most common soil transmitted helminth causing anemia, right? Remember, so most common soil transmitted helminth causing anemia, helminth, right? Helminth causing anemia. Okay, that was your hookworm, right? Causing anemia, that was our hookworm. Okay, so these are some major differences as far as these two concerned, ascariasis and the hookworm, right? So we have talked about all of these things in the ascaris section. We have talked about the ascariasis, and the hookworm section we have talked about all these differences, right? So please do read about it, and I will see you in the next one. Thank you.